Hello there. Hi everyone. It's Rendy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here with our 2:30 update on the impact of the COVID-19 epidemic on Mobile County. Yesterday, 25 cases of COVID-19 were added to our case count, so we had 25 Mobile County residents reported to us as COVID-19 yesterday. That brings our total number to 2,781. Most of those laboratory confirmed, and only 19 counted as probable cases, which means they had disease and exposure but no laboratory test. We had one additional hospitalization added to our count yesterday. That brings our total number of hospitalized to 264, or around 10%. And this is very close to what we see across the state and nationally. And we have added one COVID death to our case count, which brings the number who have died with COVID disease to 130, or around 5%, which is also similar to some other statistics that we've seen. So again, we are continuing to see cases added every day. So we want to just remind you that although we often give different pieces of information when we're giving our daily presentation. We had a comment from a Facebook listener wanting to know why we were changing our story from week to week, and I just wanted to, not quite sure what they were talking about, but just wanted to make sure I emphasize that our prevention messages have stayed consistent throughout the very beginning of the outbreak. Yes, we have learned a lot, but from the beginning we have said, stay at home if you're sick, wash your hands, cover your cough, maintain a 6-foot physical distance from others when you're in the community to protect yourself from COVID transmission. And then a few weeks into the outbreak, CDC and we followed suit in recommending the use of cloth face coverings. So I just wanted to talk a little bit more about that. You know, a cloth face covering may not protect the wearer. So if my face covering may not protect me, but it may keep me from spreading germs to other people. So I want to just review some things that come from the Centers for Disease Control website, that COVID-19 mainly spreads person to person and through respiratory droplets that are produced when an infected person coughs or sneezes or talks or sings or shouts. And these droplets can then land, on the nose or mouth or in the eyes of people around them, and possibly could be inhaled into the respiratory system, into the lungs. So, there are studies and evidence on infection control that report that these droplets usually travel, around 6 feet, 3 to 6 feet, or about 2 arms lengths. So these are some of the reasons why we are still strongly recommending the wearing of a facial covering and a physical distance of 6 feet. So wear your cloth face covering in public settings, or where social distancing and physical distancing is difficult to maintain, like in grocery stores and pharmacies and gas stations and churches. And again, it may slow the spread of the virus by helping people who may have the virus and don't know it from transmitting it to others. So again, you just want to wear it so that it covers your nose and your mouth fully. And then when you remove it, take it off by the straps. So again, I wear the mask to protect others. I want you to wear your mask to protect me. So again, we all have a part to play in keeping our community safe, and we strongly recommend and encourage the wearing of cloth face coverings when you're in public, particularly in those settings where it may be difficult to maintain that 6-foot physical distance. All right, let's see what else we have to talk about today. About washing it. All right, CDC recommends that you wash it, either with soap and water by hand, or you can put it in the washing machine. If you dry it in the dryer, try to put it on a high setting, so high heat kills germs. And if you let it air dry, just flatten it on the surface so that it can air dry. Make sure that it's nice and dry before you wear it. And again, it should be worn by anyone over the age of 2, unless you have difficulty breathing, and then we would not want you exacerbating a situation where you might have already have trouble breathing by wearing a face mask. So those are the 2 exceptions to wearing face coverings in public. All right, here's a question from Facebook. Are there false positives on the COVID test? The answer to that for the PCR test is rarely. That PCR test, the predictive positive value is so high that we rarely hear about false positives. And then the question goes on that if so, and you have no symptoms and test positive, what should you do? So false positives rarely occur. However, we do have people who test PCR positive who do not have symptoms. We also know that people who were previously symptomatic and tested positive may continue to test positive for many weeks and sometimes several weeks after their first positive test. And what is happening here is that the PCR test, it tests for live virus, but it also can detect virus particles. So after someone has recovered, if they continue to test positive after that, it's not a false positive. What's happening is that PCR is detecting particles of the virus. And we believe that at least by 10 days after a positive test in someone who's no longer symptomatic, that you're no longer spreading virus that can still live and infect others. Okay, here's a question from the media, trying to find out if we've made any connection between COVID-19 case counts and Memorial Day. And my answer to that is we did not see a large spike in cases related to Memorial Day. Memorial Day, I believe, was the 25th, and for the 2 weeks after that date, we saw about the same number of cases week over week. So I don't think that there was a large primary transmission event that happened around Memorial Day. We're keeping an eye on things to see if secondary transmission will increase, perhaps as a result of people who got infected on Memorial Day and are now spreading it to others. So stay tuned for that. We'll keep watching those numbers as they continue to rise, albeit gradually. Here is a question. I was hoping that the department could address what hospital capacity looks like since there have been spikes in occupied beds elsewhere in the state. So yes, we know that our colleagues in Montgomery County and other areas are having a difficult time right now. I looked at these data from as recent as yesterday afternoon, and with regard to intensive care units, we have all of the hospitals are reporting available beds in their intensive care unit. It varies from just a couple to maybe as many as 9 or 10. So it looks like we have intensive care unit beds available. We're not at capacity, so that's great news. And then the ventilator is even a better situation where across the county and healthcare facilities right now, we have more than 100 ventilators that are available should they be needed. So it looks like our healthcare system is continuing to adapt and be able to meet the needs of our COVID patients and the other patients that need intensive care. As you know, we have gone back, most facilities have gone back to performing elective and necessary procedures when they had stopped or slowed down doing that during the first part of COVID. Something else from CDC on testing that I just wanted to review. I get lots of questions about the difference between a PCR test and an antibody test, and I just want to review that for you again. There are viral tests and the antibody test. So the PCR test detects virus, and the virus tells you if you have a current infection. An antibody test might let a positive antibody test may be an indication of a previous infection. And an antibody test should not be used to determine if you have a current infection, because it can take several weeks for antibodies to develop. And we still don't know yet if having antibodies to the virus can protect someone from getting infected with the virus again, or how long that protection might last. So again, we're not using antibody tests for diagnosis. We're also not using antibody tests to provide any type of information on immunity. We just don't know enough about that yet to be able to rely on those tests. So I hope that that clears up, again, the difference between a PCR test, which tests for virus, and the antibody test, which tests for previous infection. And I believe that's all today, unless there's anything on Facebook. Hearing none, I believe there will be a joint press conference tomorrow, Wednesday. If that happens, we will not have our Facebook Live update, but we will continue again on Thursday. So thank you, be well, stay safe, and we'll see you on Thursday.